morning, everyone. How are you? Welcome to Anointed Rock Ministries, 1199 United Healthcare Workers East Uni Roundtable with wonderful guests that we'll have here. We're so wonderful to have each and every one of you here, our wonderful audience that is here, and those that are watching us online. We have some very special guests here with us, some very wonderful guests, and I would like to introduce you to them. And I'm hoping that I get everybody's names right, and if I get it wrong, correct me, please, because I want it to go out right. We have here to my immediate right, Mr. F.A. Rios, our regional director, and then in the middle, we have Representative Johanna Escamani. Did I say that right? Lopez, I'm sorry, Johanna Lopez. And then on the very end, we have Representative Escamani. All right. And then we have our member here with us, Sister Kadra Bonamy. So thank you to all of you for taking time out of your busy schedules to be with us. We are so excited to have you, and we want to dive right in, and we want to get started. So my first question is to Representative Escamani. I would like to ask you a two-part question, if that is okay. The questions that I would like to ask you is how important are health care and nutrition programs like Medicaid and SNAP for working families, especially across Florida? The second question is, how many and who do they cover?
Absolutely. Well, first of all, thank you so much, Pastor, for hosting us today for this conversation. Thank you to our online audience as well. Myself and Representative Lopez are proud to serve parts of Orange County in the state legislature. We're actually going to be on our way to Tallahassee later today. And so we join y'all really near the tail end of legislative session as we are approaching the budget conferencing process, which is where the Florida House and Florida Senate will debate the state budget. And there are some very big questions for us to answer around the topic that we're addressing today, as we are seeing, of course, a lot of potential cuts at the federal level for programs like SNAP and Medicaid. And Florida is actually very reliant on these dollars. I know there's been a lot of conversation as it pertains to the impact of tourism in Florida and the potential impact of Canadians, for example, not coming to Florida and how that could impact our general revenue. That's a very important topic, but I'm actually more concerned about federal cuts to Medicaid, just because Florida has such a large population of elders, of children who come from low-income families, and of people with disabilities, which means our population compared to other states is heavily reliant on Medicaid. And to get some more specifics out there, over 5.7 million Floridians, and again, that includes very vulnerable populations, children, seniors, people with disabilities, low-income workers, rely on Medicaid for health care, and about 3 million Floridians rely on SNAP to afford groceries. And these programs are not just safety nets, they are economic stabilizers. They keep our families healthy, they keep our kids in school, and they keep our people working so they can contribute to society and, of course, hopefully gain economic stability where they'll actually be able to, over time, not have to turn to these programs and be able to sustain themselves. But when you cut these programs and pull the rug out from underneath of our families, then we're actually setting ourselves into deeper economic despair. And I don't see these as a cost to our country or a cost to our state. I see these as an investment, because we are building a long-term opportunity to address the cycle of poverty, to keep our kids healthy, happy, and strong so they can do good in school, to reduce crime rates down the road. And of course, I have with us an educator, Representative Lopez. She'll dive deeper into this. But at the end of the day, these programs are essential to our state. We have to do everything we can to protect them.
Wonderful information. Let me do this follow-up. How does Florida compare with other states? I heard one staggering number, 5.7 million. How does that compare to a state, let's say, like randomly Georgia or anything like that?
Yeah, it's another great question. So it's very large. I mean, of course, I want to be sensitive to the fact that we're also a large state. So we're always going to kind of be top tier in some of these lists because our population is so large. We're at 21, 22 million some Floridians now. But it does speak to how we have major economic disparities in our state because we're such a service-driven economy, especially in Central Florida. And so many of the essential jobs that our workers thrive in the sense that they are incredibly strong and they care about the work, but the work isn't always valued by their bosses. And so whether you're a CNA, whether you work at the airports in our state, whether you work at our theme parks, you are an economic driver. You're taking care of folks who call Florida home, who visit Florida. You are delivering billions in dollars of tax revenue by your service. But oftentimes these are folks who don't actually see the brunt of their labor. They don't see the flowers in return. And so it's so important for us to realize that Florida has some of the worst economic disparities in the country. And when we think about, too, the fact that Florida has never expanded Medicaid, it also means that we have a lot of everyday Floridians who just don't have any health insurance right now. They don't make enough money to afford private insurance, but they make a little too much to qualify for Medicaid. So we actually have gaps in our system. It would be much better for the state of Florida to champion expanding Medicaid so we can capture upwards of 500,000 to 800,000, if not more, Floridians in this coverage gap. But instead, of course, we're here worried about pulling coverage back for families who have it. And this is not the first time Florida has dealt with this controversy. I mean, to be clear, we had something called Medicaid unwinding following the end of the emergency pandemic order from the federal government, and this created complete chaos for many of our children with disabilities whose families lost their Medicaid coverage overnight. And it's so important for us to operationalize what does that mean for a family. That means that the scheduled doctor's appointment you had now has to be canceled. That means that the helper, the nurse that was coming to provide you with support at home is not going to be showing up that day, which means you're going to miss work. So I think it's really important for us to also operationalize, especially for folks who've never had to rely on Medicaid. What does this actually mean for the health and well-being of our families?
Thank you so much for that information, Representative Escamani. Representative Lopez, I would like to ask you a question, if I may. What have been hearing from the constituents regarding their fears of losing essential benefits? And the second question, is our region especially vulnerable?
Wow. Yeah, I receive a lot of concerns. You know, when I talk to them, they're very scared. I think that they have a lot of anxiety on thinking that they're going to lose a lot of funding. Remember, my district, the majority of my district is very is low income. The majority of them work at the airport or in hotels. Myself, I remember when I came from Puerto Rico, I work at the airport in a car wash restaurant, and then even work in a fast food restaurant. So I know firsthand the struggle as a single mother, and we have a lot of single parents in my district as well. So when you have cuts in funding with SNAP, you know, or maybe with your mental health, you know, it's a struggle because you have to choose. I even pay the rent, or I eat, or you know. So it's a lot of sacrifices that they have to do in order to live in Central Florida, to live in my district, because the majority of our salaries obviously are not aligned with our cost of living. So they always have to run the extra mile, have the extra job. So obviously this is gonna impact extremely bad to our families. So, and we have to talk about homelessness, you know, when we talk about this type of cuts. It is very sad that the federal level is thinking about cutting on our health, especially in Medicaid, because when we talk about Medicaid, we have to think about, like Rep. Anna Escamani was saying, about our veterans, our people with disability, our grandparents. I have this situation with one of my constituents. You know, this lady came from New York. She worked all her life, and because she has saving, she cannot have certain benefits to be in a hospice. So it's very, very difficult for them, because even though you work so hard, when you come to Florida, here we go again. You have more challenges in order to receive everything that you earn when you were working. So now she has dementia and she's not receiving all the benefits that she needs. So now it's a sacrifice for that family to support that lady in the place, so in the hospice, so she can have a dignity a life with dignity, you know. So I think that those are great examples. You know, I also see the immigrants having the same problem. Now you feel fear. Now you don't have, you have to be, you have to be hiding sometimes, even though living as an invisible person because you're scared that if you do something, even though, you know, to defend yourself, you feel that you're going to be accountable for something that you are not doing it. So here we go again. Our immigrants, our veterans, our disability communities, our elderly, our single moms, single parents, you know, grandmothers. So it's a lot of problems. So what can we do? And I think that's the the great question. And you know, we are advocating. We don't want to talk about party affiliations. Sadly, when we look at the TV and we see the debate, we know who is the group who is supporting Medicaid and advocating for more funding on that silo. But you know, because we're here, I try to be very respectful. I think that we have to be very engaged in our community, especially in campaigns, in register to vote. I think that registering to vote is the key to make people accountable. And sometimes, you know, we don't have maybe transportation, or maybe we don't have people who can help you, but you can call us, you know, during campaigns, and we can make it happen. So I think that this is something that make us think. We have 4 years now. We can advocate and go into debates and keep requesting more allocation, but at this moment, you know, our hands are kind of tied. So we need our community speaking up about this over and over and make accountable the people that are trying to cut those funds for our communities. I think you have a second question, and I kind of
No, you're doing good. You got me tied in, so
perfect.
I'm ready.
So,
I'm ready to go fight right now. I'm so serious.
And you know, and it's also, you know, the language barrier sometimes is also another challenge for our communities, because they don't know sometimes where can I go, and you know, what can I do, and you know, we can help each other. You know, if you think that, you know, you don't, you know, your representation doesn't have a Spanish speaking person, you know, reach out to us and we help the other representatives. So we work in teams with each other. So doesn't matter which language you speak, you know, even Haitian Creole, you know, just come to us, you know, Spanish, come to us. Doesn't matter. We're going to find a way to guide you and to let you know where is the best place to go to help you.
Right. First of all, I want to say great statistics from Representative Escamani and a wonderful, relatable touch from Representative Lopez. So thank you for that. Now, the second part of that question, is our region especially vulnerable? Is our region especially vulnerable? If our region, our district that you're in, is it
Extremely.
especially? Okay.
Yes, yes. As a teacher of Colonial High School for almost 20 years, and living in the same district since I came from Puerto Rico in 1998,
Okay.
you know, we still have the same struggles.
Okay.
Our district District 43 is very old, especially, you know, like this area of Englewood Community Center, Corey 4. I used to live here in Corey 4, by the way. So I live in my district since 1998, and the struggle's still there. We see a lot of mobilization because sometimes they cannot afford, not even the apartments when the years pass, because every year you have an increment in your rent. So they even have to move to other counties, to Polk or to Davenport, to afford, you know, where they're gonna live. The salaries, you know, are terrible. You know, we try, you know, we tried, but are not aligned with the cost of living. And we see even our teachers are struggling. Imagine our workers at the airport. Imagine, and we still fighting for salaries and benefits. So imagine how much struggles we have. We have a diversity, a diverse community. And the diverse community. I was talking with one of the priests in Englewood with Padre Jose, and Padre Jose was telling me, that his PhD is based on English in ISO adults. So he told me, that our district is the district in the nation that speaks Spanish more than English. So I didn't know anything about that until he told me. So I think that we have a lot of barriers when it comes to the language. So sometimes I love to share my story because, people might feel related to my story. Being a single mom, work at the airport, fast food restaurant, my mom clean houses for living. And let them know, we can do this. We can do this together. Being single, I living check by check. This is our our families are living that situation. So and the language barrier that at the beginning make me feel uncomfortable to follow up, with the system and find better ways of better opportunities of salaries. Maybe I didn't dare to go to the school until I have a person in the complex that told me, "Did you study? What did you study? Go to Colonial High School and be a volunteer and become a substitute and then became a teacher and then teacher of the year." But I did not believe in myself because at the beginning I did not know anybody. When I came here, I did not have any family member. And I think that sometimes we feel very isolated and alone because we don't trust. We don't know who is the person who can help us, advise us in how to navigate the system. I truly believe that my students inspire me to become better and better and find more opportunities, even in the school system. And I think that we have a lot of leaders in our communities that, like you in the church, that I know they're
We here.
open. Yes, we're open to help them. And, we have a lot of benefits in the county, and in the city. So sometimes when we cannot help immediately, we can refer our constituents to find better opportunities, for example, paying the rent. But now with these cuts, we're going to have that struggle again. Because if we have a problem to pay the rent, one of our constituents, maybe with these cuts, we're not going to have more opportunities for them, to support them with something, electricity bill or water, something that can alleviate the way they are, trying to live or survive in Central Florida. But it's important to share our stories because we never know who is the person who is close to us that can be helped and and at least refer that person to somebody. Sometimes have people even from Deltona, immigrants, etc. So I think that the main advice is to, number one, you're not alone. Make sure that you acknowledge that you're not alone, that you have representatives that know your struggles because we live those struggles. And number three, there are still opportunities, and I know that we are living in a situation that hope sometimes is hard, but I strongly believe that we can make a difference in our constituents' life. Just connect with us, call us, and we're gonna try to do our best to help them.
All right, amen. That's a great, strong coalition. All right, Director Rios, I get to you. Got to get to a brother on the panel. I have two questions for you. First question is, what type of essential services are provided for True Health and to whom? And the second question is, how much of these services are made possible by Medicaid coverages at your centers and facilities in general?
Well, good morning. Thank you so much for having me here. It's truly a pleasure to have the opportunity to speak about this important topic. True Health, we've been in this community since 1977. We operate as a federally qualified health center, providing high quality services to all. It doesn't matter your background. It doesn't matter if you're a citizen, a resident, or a non-documented immigrant. You're still a patient in need, and we're here to serve you. So we see about 50,000 patients on an annual basis, over 100,000 encounters. Out of those, overall, 50% of our patient population is Medicaid beneficiaries. When we dive deeper into this specific zip code, which is 32822, 8% of our patients are in this zip code, and 44% of those patients are Medicaid beneficiaries. So it speaks volumes to not just how crucial Medicaid is to us as an FQAC, but how important is it for the patient to have access to a provider, to us as the provider, by having Medicaid coverage. Some of the services that we provide include adult care, pediatric care, dentistry, podiatry, lab work, pharmacy. We have a community access team that helps folks get enrolled in Medicaid, SNAP, CHIP, and the Affordable Health Marketplace. So we're very ingrained into this community. We have actually, I just came from our location down in near Ana Jimenez, which is on Semoran and Hoffman. Please come see us. We're more than happy to see us. But at the end of the day, you know, as a federally qualified health center, Medicaid is integral to our success in helping our community. Yes, we as an organization have a sliding fee scale discount program that if the patient loses Medicaid, they can still receive services to us based on their household size and income. But that's only part of the equation because we can only go so far. If we have a patient that needs a specialty that we don't offer and that patient is uninsured, that person is responsible for their fees, whatever fees that may be. Some specialists will not even see you if you don't have insurance. So it's really important because that's what's going to help the patient have a healthier lifestyle. If you have coverage, you're more likelier to go to your doctor. You're more likelier to have a chance at a more favorable health outcome. So, hope I answered your question.
Yes, you did. Wonderfully. And I did not know you provide 50% patient care to those, especially in our community. So that's good to know. Now I want to ask a question to Ms. Kadra, a caregiver that is with us today. I have two questions for you. First question is, what do healthcare workers who are nurturers by nature feel about the possible cuts to Medicaid, Supplemental Nutrition Assistance Program, SNAP, and other programs? And then what will happen to Floridians who will no longer afford or even access these services?
Thank you, Pastor. Those questions are, it kind of tug on my heart. As a healthcare worker, I've been a CNA for 21 years. Most of our residents in long-term care live off of Medicaid. We do have residents where their anxiety has increased, worried about these cuts and what it's going to look like. As a healthcare worker, I myself do not have any children, but most of my colleagues do. And they themselves, most healthcare workers do not have health care. And we do not accept the health care because we cannot afford it. CNAs, we unfortunately fight. Thank God we have 1199, that we have some better wages than some of the long-term care facilities who do not have a union. But us, it's still not a livable wage. I myself, I make do because I don't have children. But some of my friend girls that have 1, 2, 3, 4 children, they depend on this Medicaid. They depend on this SNAP program. What other cuts could they cut if this is cut from them? If they're already not accepting the health insurance in the facility, because when you don't accept the health care inside the facility, you get $1, $2, or $3 more on your salary for not taking the insurance. So they're already using that. Housing, rent. I just left my place, which was $1,750, to pack my things up inside storage and move in with my mom. This is my personal story. So can you imagine folks who have children? Actually, so where would the cuts go? Where are we going to put them? Like, what are we going to do with these children that depend on this SNAP program, this nutrition program? Like, what are we
where do we go from here?
Okay, that's a hard tugger. That saddens me because one of the things that the church stands for is helping those that are in poverty, that cannot do for themselves, those that have no voice, those that are marginalized, those that are unheard, those that are silent, isolated. These are some of the things that we need, and I'm glad that this information is going out on this platform so that people know that there are individuals out there fighting for you. And sometimes we just need to see some faces attached to our fight. Does that make sense? So I just want to point that out. Okay. I'm not the smartest man in the world, but I just got to ask this question. I'm sorry. If they cut Medicaid, doesn't that bother jobs?
Yes.
Does that mean we'll lose jobs in a way? Like, if you're cutting that much money, that means that takes away from those that have to provide the care. So that means we got to either cut salaries or people.
And to be honest with you, cuts have already been made because a law came into place with our ratio. So we had a ratio with staff patient ratio, which a nurse can have up to 40 patients and a CNA can have up to 20 patients on every shift, 73, 3 to 11, 11 to 7, which, you know, that's meals, that's therapy, that's showers, ADLs, everything that we do for our patients. 20 patients, one CNA, 40 patients, one. So those cuts already been made there. They like to say we're not understaffed because it's a law that we can have that. So where do we go now? Where are the cuts going to be now with this Medicaid? Quality care is already extinct from the ratio alone. So now where are the cuts going to be made? What do we do to our patients who have lived their life, and right now they're at that moment where we're supposed to be the love and the care in their hands, and they're supposed to enjoy these last moments until God calls them home. What do we do with them? I mean, the times alone of a patient waiting sometimes to get care from a staff member because of these cuts is already horrible. It's horrible.
Yes, yes, please. I wanted to ask that would that impact staffing
Yeah.
at True Health?
So it's unfortunate that we have to have those uncomfortable conversations, right? Because as healthcare workers, our main goal is helping that patient. We are in a position where, as a community health center, we will do everything in our power to help that patient. Does that mean that we need to connect with another agency, whether it be local, state, or federal? Yes. We will do whatever it takes to help the patient. But if the resources go down, if the cuts go into effect, those opportunities to help patients diminish. I can't tell you how many times I had a patient in front of me and I said, I'm so sorry. I really don't have another option for you. I can connect you with this foundation. I can connect you with this organization. But as far as coverage, there is absolutely nothing I can offer you. We spoke about the unwinding, as Representative Escamani mentioned. We have the Medicaid gap as well, where we have folks that are stuck between not qualifying for the advanced premium tax credits of the Affordable Care Act, which will allow that person to have a private insurance, and they don't qualify for Medicaid either. So their only option for care is the federally qualified health center. That is either that or you go straight to the ER. And that, the cost associated with relying on the ER for your health is astronomical compared to going directly to a primary care provider. So we are definitely facing, and we worry about those cuts every single day, because if more and more of our patients have to rely on their sliding fee scale program, that means that patient will not have access to a specialty, not to the same level that someone that has coverage has. And that's a powerful statement right there.
Representatives Escamani and Lopez, I got to ask this question. I know the proposed cuts are $880 billion. Not an exact number, but what is the estimate to it impacting your districts? What is the estimate number that you can provide that may be impact to your prospective districts? Whoever want to go first, it doesn't matter.
Yeah, that's a really, really great question. I mean, it can be hard to quantify just because we don't know what the cuts actually look like, and it's hard to know who will be cut. You know, are we targeting children? Are we targeting our seniors? Are we targeting people with disabilities? And I even hate to use the term targeting because, I mean, there shouldn't be a target on anyone's back right now. I mean, if anything, there should be accountability for private insurance companies who are denying claims back and forth and constantly dragging their feet on approving essential services for our community members. So it is very frustrating because, I mean, there are clear areas of reform needed in the field of healthcare, and yet instead of addressing these actual problems that our constituents face every single day, we see the federal government going after these essential safety nets. I will say that when it comes to food at our schools, our entire district is impacted. Representative Lopez actually served in the school board in Orange County, and as she mentioned, she was an educator at Colonial High School. So I know she can speak to this more than even I can, but I'll tell you, growing up in Orange County, going to public schools here, back in the day, you'd have to sign up to receive a free reduced lunch, and it can be very stigmatizing. Recently, Orange County has actually signed up for federal dollars to provide free and reduced lunch to every child, where you don't have to sign up. You just automatically get to benefit from that opportunity. And it helps to ensure that our kids have their tummies full and they can focus on school and not worry about the stresses of not having dinner at the table when they go home. Those programs are at risk right now. And there's a big question mark on, well, is the state going to step up and fill those gaps? And I can tell you that based on the budget we see right now in the legislature, there is no initiative being taken whatsoever to address potential cuts to federal funding on these essential programs from SNAP to Medicaid. And again, just to stress how large Medicaid is as a revenue source for the state of Florida, Florida's budget is cut into about thirds, if you will. A third is from general revenue, which is when you and I go buy something at the mall and we pay sales tax on it. That silo also includes corporate income taxes, which is very low in Florida. In fact, if you were to compare the taxation we generate from everyday people compared to corporations, it's like comparing a 30-story store building to 3 to 5. So it's a pretty huge distinction between how much we generate from everyday people compared to corporations. Another third are what are called trust funds. So for example, when you go buy gas and you pay a gas tax, that goes into a transportation trust fund. Those dollars are more restrictive. They can only be spent on things like road improvement and so forth. So we have several trust funds as well in Florida. And then the final third is federal government, is federal funding. So we're talking about $30 to $40 billion that the state of Florida receives from the federal government, and a huge proportion of that is Medicaid. And so even if you think it doesn't impact you, it absolutely will. Because what ends up happening when someone can't get preventative care through Medicaid, they end up in our ERs, and they end up needing more intense care, creating delays for everyone, and not being able to afford that care, which means it gets passed down to everyone else. And so even if you are not a Medicaid recipient, I think it's really important to understand that this entire ecosystem operates with all of us having some sort of impact and effect. And so as you know in your earlier question, maybe you work in healthcare. If these dollars are gone, there is a risk of you losing your job. Maybe you are a tutor. If children can't afford their food, parents are going to cut tutoring programs because they have to make decisions, right, of what the essentials are versus what the unnecessary extras are, if you will. And so be very, very mindful of the ripple effect for everyone watching back home. Even if you don't feel like you are directly impacted, you will be. You absolutely will be. And so I think it's important to conceptualize this ripple effect. And at the end of the day, society should always be judged by how we treat the most vulnerable. And if we cannot deliver on that very basic element of ensuring that our children and seniors and people with disabilities are not taken care of, then why are we here? Why are we here? And I think it's important to also highlight that these tax cuts are being done to then give, these budget cuts are being done to then give tax breaks to billionaires, period. That is the goal of the Trump administration. That is not a red versus blue point. the reason why they're slashing federal programs, they're eliminating federal workers, it is because they're trying to cut the budget, the federal budget, to then turn around and give tax breaks to billionaires. And we've seen it before, trickle down economics does not work. And so let's be clear about that. We should put money in the pockets of everyday people, not in the hands of billionaires.
And to add to that point, they want to extend those tax breaks from 2017, $2.2 trillion, to extend them to last probably for the next 10 years, which will add our estimated $9 trillion to our deficit. Sorry, I did a little reading. But the point is, that's what it would do. Representative Lopez, please add to that.
Yes, with these cuts, what we see, we're gonna have an increment in mental health situations. Obviously, when you cannot pay your rent, when you cannot have money to provide a good food for our children, that's gonna cause mental health situation. It's gonna be an increment in crime, in the crime rate, because now we see a relationship between mental health and shootings. So I think that there is a relationship there that we can see something about crime also in our state. Also, increment in evictions. So I also see more poverty. So if we see more poverty, so the low-income families will affect the Title I schools. So now we're going to have an increment of Title I schools because it's based in the income of the families that provide that content to transform that school in a Title I school. When we have a Title I schools, the grade performance also is impacted. And when you see an impact in the grade of the school, even the property value also decrease. So I don't know if you see all of this, all of this going on. I also see in the home ownership, for example, you cannot be able to buy a home or a townhome or whatever. Not here in Central, not in Florida, at least, because the salaries are not aligned with the cost of living. So when you see even our townhomes is almost $500,000. And so I see that. I also see problems in general health. Stress, I have this stress in Tallahassee. My blood pressure just go up 146 over 100. This is real issues, So blood pressure, heart attacks, strokes. So we keep talking about health, and now we don't have enough Medicaid. We don't have enough support in health insurance and all of that. I know that we are working in Tallahassee in different bills that might alleviate to a certain extent the housing situation. We don't see it yet on the floor. Maybe, we are in different committees, so maybe you see it in your committees. So let's see what happens, because most of the time we see something really, really good and something really, really bad. Instead of using the funding, like Sadowski Fund in housing, they try to use something else. So, but I think, mental health, we have bills related to mental health in the school system. So there is something coming, but we also see a lot of cuts in our budget at state level that we know will affect also the health silos. So that's another conversation. We're still working in the draft. We voted on the draft. So let's see what happens if they can work it out, because this is what is coming from the federal level. What can we do at a state level so we can alleviate this situation that we see is coming? But that's, we still have 2 weeks, almost 2 weeks to keep talking about these bills and debate and voting in the bill. So it's a great idea to follow up as well, to see what can we do with amendments. She's a great amendment. She's the best state rep with amendments. For me, she's the warrior, the amendment warrior. So, it's true. She never stops. I see her as a superwoman in Tallahassee. I don't know how she do it, but she never sit down. I don't know if she eat. but she's always fighting for our constituents, and we highly appreciate that. She is amazing. So I think that's my humble opinion, but I'm here to, to receive more feedback, more recommendations. We're
Yes.
here. Use us
Yes.
to fight in Tallahassee,
Yes.
with amendments, with laws we kind of labored for the incoming session.
Right.
You can also provide feedback to create more bill proposals that will be more effective for our community.
All right, I got to ask this question, then we have to wrap up. What has the governor and the legislative majority in Tallahassee done to protect Floridians in the face of these cuts and prior? Whichever one wants to go. The amendment warrior.
I mean, the very short answer is absolutely nothing. There's
Well,
been
we wanna
nothing
know.
done at all. I mean, Representative Lopez spoke so beautifully about where we are in the budget process, and the Florida House and the Florida Senate have not addressed these potential cuts in either one of our budgets at all. And it's incredibly concerning because we do not have enough in revenue surplus to make up for the difference if we're not planning ahead and preparing for this. And it could lead to a complete just disaster in our state and vulnerable communities having absolutely nowhere to go. And of course, the irony to all of this is instead of addressing this issue, you have the governor funneling illegally $10 million from a Medicaid ACA settlement. So what does that mean? So basically, one of the state's Medicaid providers, known as Centene, was not reimbursing Floridians at the level that they should. And so ACA, which is the Agency for Healthcare Administration, reached a settlement with Centene of $67 million. That is taxpayer money. Those are dollars that should have covered the cost of healthcare for Floridians. $10 million of it instead was funneled to Hope Florida, which is a organization created under the First Lady that says they're here to help Floridians navigating affordability challenges. And instead, the $10 million was then allocated to two political organizations that paid for anti-Amendment 3 campaigns. So that's $10 million in public money that should have went to general revenue to go back to Floridians, $10 million, that instead was split to two separate political entities that did campaign advertisements. And so instead of addressing the crisis before us and putting money back into the hands of our constituents, we instead see political maneuvering and political campaigning with public money. So if anything, the complete opposite is happening. And of course, the Florida House is leading the charge on asking tough questions and holding the governor's office accountable to this, but it just speaks to priorities. And at the end of the day, a budget document speaks to our values. How we spend money defines who we are as a state.
And our moral compass. I would like to say this has been very informative. All of the information we received today has been very helpful, and I would like to thank this panel for joining us here today, and as well as our organizer and all those that played a wonderful part. Thank you to our media team and those that shared. Please share this information. Please, please, please. And again, we would like to thank Ms. Kadra Bonamy. We would like to thank, and I want to call her this as a sign of respect, Dr. Anna Escamani. And I would like to also thank Representative Joanna Lopez, and I like to thank Director F.A. Rios. And I would like to thank you all for being here and joining us today. Hopefully you got something out of it and we provided some type of information that was helpful. Thank you so much, and you have a wonderful day, and we will see you next time. Thank you so much. Have a great day.